Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over 7 surprising causes and risk factors for plantar fasciitis. So understanding those causes will help us to eliminate some of the triggers that could cause plantar fasciitis. So one of the causes is pronated foot or flat feet. I personally had plantar fasciitis before I treated effectively around like 10 years ago. And I had pronated foot. Some of the patient, actually, we can correct the pronation of the foot. Other patient, it's not possible to correct it. So proper evaluation will help to determine if the pronated foot is correctable or uncorrectable. If it's not correctable, there is orthotic and other exercises we can do to help with the pronated foot. But that is actually very high risk factor or cause for plantar fasciitis. Usually in your foot, you should have a kind of arch here. So it's kind of like a bow on the bottom of your feet. So that arch, normally you should have an arch. Pronated foot, you don't have that arch and it's totally collapsed flat. So instead of your arch like this, your feet arch like this, it's totally flat. That's pronated foot, and that's a risk factor for plantar fasciitis. The other common risk factor for plantar fasciitis is abnormal gait, which means you not walking the right way of walking, heel-toe walking. So there's a lot of gait deviation that could trigger the plantar fasciitis. Think about this way: if your car's out of alignment, your car will wear your tires on one side more than the other side because the weight bearing is unevenly distributed on the tires. That exactly the same thing happen. If your gait is abnormal, it's like your car out of alignment. The more you're gonna walk, the more you're gonna have issue because your weight is not distributed evenly, or actually your weight is put on the wrong location in your foot. So proper gait, extremely important part of the treatment to eliminate in order to not aggravating the symptoms. The third factor is tight calf muscles, and usually that happens when you have wearing high heels, bad shoes, and also back to the second cause, abnormal gait. So if you walk funny or you walk incorrectly, you will cause tightness in your calf that will lead to plantar fasciitis. So very important to address the calf simultaneously while we actually walk properly and while we actually wearing the right shoes. So the fourth cause is repetitive stretching that could cause by a tear or inflammation. So if we start with the bad pronated foot, adding to it abnormal gait will cause calf tightness, and that could cause repetitive strain on your plantar fascia, so that will cause the plantar fasciitis. It's usually, if you don't have a trauma or accident, it's usually repetitive strain injury from combination of bad shoes, bad gait, bad anatomy that is actually increasing the risk for plantar fasciitis. The fifth cause is repetitive impact. So if you have bad anatomy or bad shoes and tight calf, and you add to that high mileage like running, jumping, dancing, that increases the chance of wear and tear and experiencing the plantar fasciitis. The other causes or risk factors are obesity, long standing. But remember, the first four are the one leading to the last three that could cause the plantar fasciitis. And I will leave the link below this video for the most powerful 3 effective treatment to relieve and get rid of plantar fasciitis. If you have any comment or question, leave it in the comment section and I will answer it in a future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.